Anyone who works in a cardiothoracic ICU will eventually come across what's known as an Impella. An Impella is what we call a left ventricular assist device. Prior to the use of Impellas, a lot of patients would be put on intra-aortic balloon pumps with the idea that intra-aortic balloon pumps are going to reduce myocardial oxygen demand and increase myocardial oxygen supply. Impellas basically do something very similar where they help evacuate the blood that's in the left ventricle to allow better contractility, and then also ejects that blood flow into the aorta, which then increases the amount of blood flow that's going to be going to the coronaries. Not only does it help the left ventricle, but it can also have upstream effects like decreasing the left atrial pressure, decreasing pulmonary cap wedge pressure, which decreases the afterload for the RV, ultimately helping the RV as well. Now in the ICU, occasionally when you're dealing with patients who have Impellas, there's going to be moments where patients have what's called suction events. Suction events basically describe a moment where there's myocardium tissue that's literally getting sucked into the Impella or the device. Usually what this means is that you're at too high of a power level and you've evacuated all the blood that's in the left ventricle. And now that it's sort of emptied out, the myocardium or the muscle of the left ventricle starts to close on itself and then just closes on the Impella itself. The best way to evaluate this is with a bedside ultrasound, where you look at the parasternal long axis view and you can see the aortic valve and the left ventricle, how much volume of blood is in the left ventricle, and also the device placement. Now, if it looks like the left ventricle is full of volume and it doesn't seem like this is a hypovolemic issue, then the next thing you might want to consider is this a positional issue? One of the things that we can look at is the inlet valve, which is where blood is getting sucked up into the Impella from the left ventricle, and that distance of the inlet valve to the aortic valve is pretty specific for where we want it, depending on what type of Impella device we're using. What we commonly use are two different Impella devices. One is called an Impella CP, which can be placed percutaneously either in the femoral artery or an axillary artery, or the Impella 5.5, which is usually a surgical cut down and then inserted directly into the aorta or into an axillary artery. For the Impella CP, you're going to want a distance of 3.5 centimeters from the aortic valve to that inlet valve. And usually on ultrasound, you can see that inlet valve, it's hyperechoic on the Impella device. And then the aortic valve, you can usually pick up pretty easily in that long axis view. For the Impella 5.5, luckily it's pretty similar to the actual name itself. The name describes how much flow you can get, which is 5.5 liters per minute. But the distance of the inlet valve to the aortic valve is somewhere between 5 to 5.5 centimeters for its optimal position. There's also scenarios where the device itself may have been rotated and now your inlet valve is against either the mitral valve apparatus or one of the walls of the left ventricle, and you might have to actually rotate that device. A couple crucial things to keep in mind when you're repositioning this device. You usually only want to move the device about a centimeter at a time, and if you can ideally have somebody doing an ultrasound while you're moving the device so that you can actually see it move, that would be most ideal. The other thing that you're going to want to do is turn down the performance level to P2 so that you're not actually causing any trauma to surrounding myocardial structures and mitral valve itself. That way, there's not too much activity that the Impella is doing, and then once you get it to the position you want, you can crank it up to whatever performance level you had it before and see if your flows are improved with this change in distance. So a couple numbers to keep in mind: your distance from the inlet valve to the aortic valve for the Impella CP is going to be 3.5 centimeters. For the Impella 5.5, it's going to be around 5 to 5.5 centimeters. And before you move that device, make sure you turn the performance level down to P2.